So to understand a little better how this fits into a broader vision of healthcare, I want to introduce the next speaker, who is Sandra Shewry, who's a colleague and a friend. Her current position is Vice President for External Engagement at the California Healthcare Foundation, where she leads health policy communications, government relations, and audience engagement functions. Wow, that's interesting. Yeah. But where I actually met Sandra was she was a leader in state government, and I met her when she was the director of the California Department of Healthcare Services, which at that time was not just the Medi-Cal program, but also public health. So she oversaw both of those programs, and I think that it'll be quickly obvious that she is not only very smart, but a bundle of energy, and when you can get her effort behind you, you can go somewhere. So let me introduce Sandra.
Good morning. I am so excited to be here today because you are the pioneers, the doers, the reformers, and you're not only taking this idea of community paramedicine that we all know can really make significant impact in communities to fill needs, but you're putting it into action. And that is just wonderful and something to be celebrated. So I wanted to start, and any other time I am asked to come to the podium, I will be saying yay. And my role is partly pom-poms up for you who are doing this really important work on a topic that is very important to our communities. So I work for the California Healthcare Foundation. I just want to introduce you to the foundation and what we're about. We have this mission of advancing meaningful, measurable improvements in the way the healthcare system provides care to people in California. We have a particular interest in low-income populations and those who aren't well served by the status quo. We are a philanthropy. What that means is we have an endowment and we make grants. We support about $23 million in charitable activity each year. And our particular space is health policy. Some foundations and philanthropies are dedicated to actually providing care. You know, you might see free dental clinics and those kind of things. We're interested in system change. How do we get overall the design of things to be better? Our particular emphasis right now is, and our tagline, if you will, is healthcare that works for all Californians. And we think healthcare that works is healthcare that's accessible and available, respects patients' wishes, it's available when and where you need it, it's proven to be effective, it looks at the whole person, both physical and behavioral health needs, and it's sustainable. When you think about community paramedicine and why this project would interest us, I hope you see yourselves and the work you do in many of those factors. So this alignment was just obvious to us. Because we're interested in measurable improvements in the delivery system, when Howard came to me, we had coffee one morning. I remember we're at the corner of 8th and S in Sacramento, sitting on benches, and we worked together. He was the public health officer when I was the director of the health department, and we were just catching up, and I said, so how's your new job at EMS? You know, what are you doing over there that's interesting? And he's like, well, I've got this great idea, and, you know, paramedics, there's so much potential. We could really be a part of this health reform movement. We could expand access in really meaningful ways. And it just grew from there. So the idea of why our foundation would be interested in being a part of this, we see it as all to our advantage. You are doing the kind of things that we dream of other people in the field coming and saying, we would like to do this. So part of my purpose this morning is really to say thank you. Thank you for doing this really important work. We see it as expanding access to underserved populations and as a way of improving the care process by aligning patient needs with resources provided. You know, some of the projects are more on the access side, bringing services where they weren't before, but they all have this thread of trying to figure out how to use our precious human resources, financial resources, institutional resources to align really well to what patients need. Howard covered this, but my point on this slide was just to be transparent with you because I don't know most of you. You may not be aware of the foundation, of just what is our contribution here. The majority of the work and the financial commitment on these pilots is being done by you. You, the pilot sites, and your partners are putting in the paramedic time, both for participating in the training and the interventions. You're doing data collection and doing all kinds of consents that you wouldn't normally have to do. EMSA is providing executive oversight. They're the public owner of the project. They're the official sponsor. We're doing things that I would call wraparound. So forgive me for making it into a long list. It's a long list, but it's the little piece of the project, and I recognize that. We have the privilege of financing Lou's participation in the project, and that was a brilliant move by Howard to say, yeah, I know a guy who'd be really good project manager on this. We're also financing the independent evaluation, Dr. Kaufman. We paid for the development of the core training, small stipends, and now we're doing these educational activities. And to the extent you have a chance to talk with me during the day, I'm very interested in what other kinds of wraparound things we could do to help let people know what's going on. I hope you had a chance when you signed in this morning to pick up the pages that were flying independently out there. They weren't in your packets. It's 2 blogs we've published recently on community paramedicine. The one we posted yesterday was Ann Jensen from here in San Diego talking about a really moving and powerful interaction that she had describing the community paramedicine program here. I'd like to do more of those so to the extent you have stories you'd like to get out, we'd like to use our platform to talk about your good work. This is hard. What you're engaged in, you know, Howard is amazingly politic, and he never uses the word scope of practice. What you're engaged in is a scope of practice expansion, if we're careful. And I have had most of my career in state government, in and around the state capitol. Usually, when people say scope of practice, everyone goes, because it's so hard. So I would like to just end my welcome and morning with you to remind us of what assets we have, because scope expansions have to go through the legislative process. We are hoping the evaluation data will be significant when it does go through, and that the good work you are doing will be evaluated based on its merits. We know from the history of scope expansions that it's hard. It takes a really long time, and the window of opportunity has to be open, and we have to push through it when it's open. So the assets we're bringing to this are that the access pressures in the EMS system, in our hospitals, in our communities are real and need solution. So we have a compelling case to make. We know that community paramedicine offers this amazing variety of models and interventions that can address a broad range of local problems. That's a really strong asset. We have one idea. We have many ideas. We can see how paramedics can really add value. We have a state sponsor. That's an amazing thing, kind of a unique thing, that we have a state agency that at least at this point is committed and interested in testing out these ideas. That's an asset we can't squander. And we have LEMSAs, we have the local EMS agencies and all the partner organizations that you represent who want the flexibility to do this. So we need to take these assets, be sure that we're looking rigorously at the data that's coming out of the pilots, and we're just going to get a snapshot of early results today. And then we need to think about this hard task ahead of us, which is explaining to other people what we do and what would need to change in order for this to become the norm. So again, my main purpose today is to say thank you. You're doing amazing work. I feel privileged that our foundation is able to partner with you on this, and I look forward to working with you.